Hello, I'm Katie. I'm a Human Rights Officer here at BIHR. So earlier this year I was part of our Practice Leads programme with the Scottish Recovery Consortium, which was a really unique opportunity for BIHR because we were working not only with a community group, with working with people who all have lived experience and co-developing and co-delivering this programme, but it was also an area which we hadn't really worked in before, the area of recovery and the recovery community. And the people that were on the programme were people who hadn't really thought about human rights. They hadn't really had much training about human rights. They didn't have much knowledge about human rights. And for them, human rights were quite abstract. They didn't believe that they had human rights. They had lived experience of recovery and addiction, so they didn't actually believe that they felt worthless. They didn't know that they had human rights. So what we wanted to do is we really wanted to contextualise human rights and make them as relevant as possible. And we sort of did that by making sure that each session focused on a different theme, a different issue which people in recovery face, and making sure that they knew how human rights could be applied for that. So that was things like residential rehabilitation, lack of choice in treatment, medication-assisted treatment programmes, access to mental health care. These were all areas which we've been told were really important for people who are going through active addiction or recovery. So we sort of made them rights-based and showed people how they could use human rights to sort of challenge decisions. And by the end of the programme, I found that there's a 66% increase in knowledge about human rights, but there's also a 60% increase in confidence, and that was really important for people who didn't even know they had rights, to have that confidence to challenge public bodies. That was really valuable. And they have been doing so. They've been challenging policies and decisions and making sure that people that they work with are involved in decisions about their lives. And one participant actually got in contact with me recently to tell me that they take a photo of our 16 rights, image to every workshop they go to, every event they go to, and they tell everyone who walks past and says, "Do you know that you've got these 16 rights?" And a lot of people say, "No, why would I have rights? I'm in the recovery. I'm an addict." And just by doing that, it's empowering people and it's having that massive change in all these different people's lives.